The immune connection. How autoimmunity may be hiding behind mental illness for decades, medicine has maintained a rigid boundary between psychiatry, the study of the mind, and neurology, the study of the brain's physical structure. However, an emerging field of research is shattering this divide, suggesting that many mental health conditions may actually be driven by the body's own immune system. The discovery that autoimmune diseases, where the body attacks its own healthy tissues, can trigger psychiatric symptoms is forcing scientists to rethink how we diagnose and treat everything from psychosis to depression. The mind-blowing discovery, the shift in perspective, began with clinical observations of patients who appeared to be suffering from classic psychiatric crises. In one notable case, women presented with hallucinations, delusions, and agitation, textbook symptoms of psychosis. Yet, they also exhibited neurological red flags like seizures and catatonia. Neuropsychiatrist Thomas Pollack discovered these patients weren't suffering from primary psychiatric disorders, but from autoimmune encephalitis, a condition where the immune system attacks the brain, causing intense inflammation. The immune system is playing a role in behavior much more than we appreciate, says psychiatrist Andrew Miller of Emory University. Why this matters? A diagnostic blind spot. The implications of this link are profound. Currently, many patients with autoimmune-driven symptoms are misdiagnosed with conditions like schizophrenia. This leads to two major problems: ineffective treatment. Standard antipsychotics do not address the underlying cause, inflammation, and fail to work for up to a third of patients. Missed opportunities. Autoimmune encephalitis can often be treated with relatively simple immune-modulating drugs, potentially transforming a patient's life. The stakes are not merely academic, they are life and death. The article notes tragic instances where failure to screen for autoimmune markers led to devastating outcomes, including a suicide involving a child whose condition went undetected. Expanding the scope. Beyond psychosis, while the link between autoimmunity and schizophrenia is the most documented, researchers believe we are only seeing the tip of the iceberg. The potential overlap extends far beyond psychosis. Schizophrenia. Roughly 5% of patients may carry autoantibodies, even if they don't meet the full criteria for encephalitis, PTSD, and brain injury. A 2025 study found autoantibodies in a significant portion of veterans suffering from both PTSD and traumatic brain injury. Other conditions. Scientists are investigating links to obsessive-compulsive disorder, OCD, depression, and even dementia. The sheer scale of possibility is staggering. The human body can produce a quintillion different types of antibodies. Researchers like Christopher Bartley at the NIH suggest that many currently unknown autoantibodies may be contributing to various psychiatric illnesses. A new treatment paradigm. Current psychiatric medicine is often described as chemotherapy for the brain, using blunt, powerful drugs that manage symptoms, but carry heavy side effects. The emergence of immunopsychiatry offers a more surgical approach. If a patient's mental illness is driven by an immune malfunction, doctors can use existing treatments designed for other diseases, such as corticosteroids to reduce inflammation, IVIG, intravenous immunoglobulin, to neutralize harmful antibodies, rituximab, a monoclonal antibody, to dampen the immune response, plasmapheresis to filter harmful antibodies out of the blood. The path forward. Screening and integration. The goal is not to replace traditional psychiatry with immunology, but to integrate them. Large-scale screening initiatives are already underway, such as a project at Columbia University aiming to screen thousands of institutionalized patients for metabolic, genetic, and autoimmune biomarkers. The challenge for the medical community is to find a balance. As Dr. Pollack warns, there is a risk of overdiagnosing or overtreating patients with expensive, high side effect immune drugs if they don't actually have an autoimmune component. Conclusion. The recognition that the immune system can drive mental illness represents a paradigm shift in medicine. By improving diagnostic screening and identifying the specific biological drivers of psychiatric symptoms, doctors may soon be able to offer targeted, life-changing treatments to patients who previously had few options.